20 months into one of the worst pandemics the world's ever known, there's still no vaccine to protect people. Hard figures are impossible to come by, but the World Health Organization estimates that 150 million people have died. That's approximately 2% of the global population. For industrial countries, the death rate's a bit lower, but in many low and middle-income countries, the death rate's much higher. As many as 30% of the seriously ill have died. In the U.S., there have been an estimated 82 million severe cases and 15 million deaths. At least 5 million Clade X deaths happened because adequate medical care wasn't available. No doubt, millions of others will have died prematurely from heart attacks, strokes, cancer, and the like. The U.S., along with the rest of the world, is in its worst economic depression in history. The Dow Jones Industrial Average is down 90%, the GDP down 50%, and unemployment is running at 20%. Unemployment would be higher if not for the dramatic shrinkage of the available workforce due to death and disability. U.S. healthcare and health insurance systems, as we knew them, have collapsed. Health insurance companies ran out of capital and couldn't pay their bills, leaving hospitals without operating funds. In addition, most medical supplies are unavailable. Half the healthcare workforce has died, become disabled, or quit. The remaining healthcare facilities can't cope with all the patients, and consequently, death rates are soaring, both for Clade X patients and for everyone else. It was only by nationalizing the healthcare system that basic medical care is still available. The government now pays for, controls, and rations all medical care. The U.S. is in a constitutional crisis. The president remains in critical condition, and while the vice president is out of intensive care, he remains unable to assume his constitutional duties. Therefore, the Speaker of the House is the acting president. Continuity of government is a major concern. 1/3 of the U.S. Congress is dead or incapacitated, as are 2 members of the Supreme Court and senior members of the administration. Government functioning at the federal, state, and local levels has been brought to a near halt. After the failure of the first vaccine that seemed so promising 15 months ago, along with several other candidates, we now see fresh optimism. The Omega vaccine, which has finally been shown to be safe and effective, is just starting to be deployed as fast as it can be manufactured and distributed. 1/3 of Americans are expected to have access to the vaccine in the next 6 to 8 months. Global vaccine distribution and dispensing, which is an enormous undertaking in the best of circumstances, has been slowed in many locations by riots and looting at vaccination sites. Infectious disease specialists seem to agree that once 80% of the people have been vaccinated, the epidemic should be brought under control with an ultimate 20 million deaths in the U.S. These same infectious disease specialists say we're lucky because the virus is similar in some ways to common para-influenza viruses, and only 1 dose of vaccine is needed. The situation in most of the rest of the world is much worse. Massive loss of life, economic collapse, famine, and civil unrest. There's been a mass exodus from cities, adding to the spread of the disease and making vaccination programs even more difficult. The nagging question: what would have happened if we had a vaccine many months earlier? If the first vaccine had worked and started to be deployed at 6 months into the pandemic, the U.S. death toll could have been reduced from an anticipated 20 million to 6 million, with similar reductions in economic and societal consequences. On the other hand, what if years go by without a vaccine? Then, experts tell us that we could eventually see 30 to 40 million deaths in the U.S. and more than 900 million around the world, 12% of the global population. Eventually, once almost everyone's been exposed, the disease will either burn itself out or become endemic, like the dreaded childhood diseases of prior centuries. What the world will look like when it's done is still very uncertain.